One of the key pillars of longevity is your nervous system health, okay, or your mental health. One of the prevalent problems that people face these days is anxiety or chronic stress or even PTSD.
Yes.
And so the Neuro Reset is a procedure that we've kind of pioneered here at Extension Health, which involves, it's 2 steps. Okay, the first step is a stellate ganglion block, and the second is a vagus nerve hydrodissection. I'll kind of go into what these both are. Okay, the stellate ganglion block is a injection of local anesthetic directly here in the neck at the C6 area. And what this does is it blocks and resets the sympathetic nervous system, or the fight or flight response. In a lot of people with chronic stress and anxiety or PTSD, you have an overly active fight or flight response. Your body always feels like it's in constant stress. You're trying to run away from a tiger. A block that physically stops that fight or flight state for several hours at a time. And when that system reboots again, it should come back at a slower firing rate. Okay, so it's like kind of hitting a reset button, a reboot computer to your nervous system. Multiple studies have shown that this is really effective for PTSD. It can drop anxiety by 50, 75% at 1 month out. It's also useful for long COVID. We did an internal study on 20 patients with long COVID. It really helped a lot with dysautonomia and some of their kind of COVID-related fatigue. By also, what this does is it actually improves blood flow to the brain. It vasodilates your blood vessels that supply your brain.
And you said you can also inject exosomes in it, which a way
Yes.
to get into your brain.
Yes, that's a second part of the Neuro Reset. So the first part is that stellate ganglion block that I talked about. The second thing is this vagus nerve hydrodissection that I do. And so this is a relatively new procedure. It's not a lot of doctors that do this. But the theory here is while we block the fight or flight state, how can we make the rest and relax state or the parasympathetic system work better? A lot of people are talking about these vagal nerve stimulators. How do you improve your vagal nerve? Singing, humming, cold plunges, sauna. There's a lot of these things that you can do, but as an interventionalist, can you actually directly inject the vagus nerve and make it work better? The concept exists in pain management, right? When we hydrodissect peripheral nerves to release the nerve, feed it nutrients, and then that pain gets better. So a similar concept can apply to the vagus nerve as well. You inject the vagus nerve, we inject a combination of glucose in the form of dextrose, glucose, saline, peptides, sometimes exosomes. All right, we create a column of fluid around the vagus nerve, which can decompress the nerve, feed the nerve full of nutrients, and that should theoretically make that nerve work better. The vagus nerve also communicates very kind of directly with the brain as it exits that foramen in your skull. And so by creating this column of fluid, when you put exosomes in there, ideally this column of fluid communicates directly with the central nervous system. So you can get exosomes as close to the central nervous system as possible.
That's beautiful. I did it 2 months ago and I felt incredible. I actually couldn't get up from bed for like an hour. I felt like this very deep relaxation sleep.
Yes. It definitely makes people a lot more chill, less reactive.
Chill, and then happy and just kind of like nonchalant.